Hey guys, so real quick before we go into this video, I'm going to make this really short because the video is already long. I forgot to mention that you get to shadow your charge nurse. That is part of the shadowing process, and basically you learn how to be charged, which is basically being over the unit, making making the staffing sheet and for the next oncoming shift, and just holding the floor down and interceding with whoever needs help and just taking charge of the unit. And sometimes that means admitting people and discharging people and stuff like that. So you do get that opportunity to know what the charge nurse do, which is a lot, by the way. I am 10 months out of my residency program. So this is December that you're seeing this video, and all the videos that you're going to see me post on are from earlier this year. I'm just getting a recap, so please be mindful of the time difference. And at the end, I just want all to know that one thing that I can say learning through this whole program is that my focus is to be a difference, not just different. All right, enjoy.
Let's just put it on the record. My face has been breaking out, and my pimple decided to have an attitude today, so it's bothering me because I see it, and I know that you see that I see what's on my face, and we're just gonna get out the way. Yes, we see you there, but let's just get back to the video.
Hey guys, it's Jaleesa, aka Nurse J. I just wanted to come to you and talk to you about my L&D residency and orientation. As of today marks my 2 weeks, actually I'm going on 3 weeks off of orientation. Yes, yay! So I am, that just basically means that I'm officially on the floor on my own, no preceptor behind me, no one shadowing me. I am on my own working as a whole nurse. So when you first start off with the residency program is a 13-month program, first of all. And through that time, you get an orientation to the unit. You also get an orientation working on the floor, which is the 12 weeks that they give you and part of the contract. In that 12 weeks, you have your preceptor. Sometimes you have one and sometimes you have two, just so that they can balance it out. I had two preceptors. One couldn't work all the time with me because of her schedule and second job. So they made sure that I had a second preceptor that would follow up with me, which was fine. It just showed me how to balance with different people, and I opened my mind to different opportunities and see how different nurses apply their practice when it comes to labor and delivery. So unfortunately, I had to go through a series of preceptor for my second one because my original preceptor ended up having a medical condition that caused her not to be able to work. So they had to go and find me another preceptor, which was frustrating because I felt like I was just constantly almost like you're dating, not dating, but you had to constantly find someone that you meshed with very well and could get along with and respect you as a nurse trying to learn, and not just respect you, but actually desired and loved teaching. Your preceptor needs to love teaching and guiding, and that is so important when you're trying to find a preceptor. So I went through 4 preceptors until I found that golden one. Yeah, so the preceptor that I ended up being with was perfect. We meshed well. She loved to guide me. She didn't get mad if I kept asking questions, because you're going to ask questions and they need to be able to be receptive to that. She was very patient, and I say patience. She was amazing and lovely. And so I had 2 great, I love them, preceptors. And I say I advocate for that. Like, if you have gotten to the point where you know that the precept that you're with is not meshing with you well, you need to advocate for yourself. Go to your educator, go to your manager, and let them know, hey, I really don't feel like we're meshing well. Is there another person that we can match up with? And they will. They will do that, because your preceptor will be the foundation of your learning, your practice. What I mean by that is that whoever you're guided by and taught, you will take on not only their habits, but their thought processing of handling things. So you have to be mindful of that. You don't take in everything. Also use your own critical thinking when you're applying your practice. But you want someone who is knowledgeable and who goes by the book. Both of my preceptors went by the book, and they were both OCD. So OCD meets another OCD, and so it was just perfect for me. And I'm not going to keep blabbing on about my preceptors, because they were exceptionally well off and amazing, but the quality of care that they gave to their patient was, I mean, exceptional. So I am very grateful of my preceptors. So your manager and your educator will do roundup. Roundup is when they just come to you and check in on you to see how you're doing. Are you getting along with your preceptor well? Do you feel like this place is good for you? Do you feel like this is a good unit for you? Do you feel like this is a specialty for you? So they're asking you these questions because as a new nurse on the unit, as a new grad as well, you can get overwhelmed. And so that would be the time to tell them, I'm really frustrated. I'm lacking behind this. I'm not understanding this. And this is just the opportunity to vent it all. And so do not hold back on that. Let them know how you're feeling, because they will be able to help you and guide you and let you know some tactics, some resources, some tips, or some therapy that you can get yourself involved with. So I had changed the lighting. The sun is coming down. So anyway, there are some tools that they give you when it comes to your education and your learning. So of course you graduated, but you don't get the detailed learning in the specialty that you end up choosing as a nurse. So as part of the residency program, which I encourage all new grads, if you want to get into your specialty of choice, you need to apply to a residency program. Have you ever tried to apply for a position as a new nurse in a specialty and they tell you, no, you need to come back when you have some experience? Well, that is you going to a residency program, because when you go into a residency program, you are learning, you are gaining detailed information, you are applying keen skills. They are teaching you things. So the tools that I've gotten through my residency program are tools that will help you if you apply to residency program. So as an L&D nurse, they gave me a flashcards, and my flashcards come in handy because if, like, now I'm on my own, if I need to like go back to something like how to set up my room, which I know by heart by now because I've done it like I don't know how many times since I started in February. So I know what I need in my room. I know how to set up an infant warmer. I know how to do an L&D admission, which can be tedious. I know what to do after an epidural, prior to delivery, my pre-epidural, immediately after you do your vaginal delivery, part 1, and then the part 2, like, you know, doing your checks because the mom stays with you for 2 hours before you send them over to postpartum. And then your checklist for the nursery, your C-section prep, if you're going to do a C-section, what you need to do for an arrival, upon delivery. It really goes into details. And again, this is probably based off of the facility that you end up working at. The facility that I work at, and my educator, she practically gave us these flashcards to utilize during our orientation, and then we just basically continue to utilize it and practice it, and you pretty much know this stuff by hand, by memory, I'm sorry. You have your PACU care, fetal heart monitoring, all of it, hypertension documentation tips, reminders, Pitocin documentation, placenta eruption if you end up getting one of those very critical care situations, what to do for preterm labor, premature rupture of the membrane, magnesium sulfate, hypertensive disorder. Yeah, so placenta previa, just to list a couple of placenta eruption. I can't tell y'all how many of these I've already experienced, but yeah. So labor and delivery flashcards, these come in handy. I love it because I can put it in my little pocket, flip it out, and go to it. So these are one of the little tools that I got from my educator. And if you go on a unit and they ask you for any advice of what you possibly needed as a resident, hey, tell your educator you would have loved some flashcards, laminated flashcards. So that's one of them. Another one that they gave me was my fetal heart monitoring pocket guidebook. I didn't have to read the whole book. I read mainly chapter 5, which talked about the pattern recognition of and interpretation of the fetal heart monitoring, because you have to read strips. And so it just talks to you about decelerations and all that stuff you really didn't get to learn in nursing school. I kid you not, when you get into your specialty, you actually go into details about what you need to know, so you will not be left in the dark, like knowing what's happening to your baby. Like, you learn this stuff. I don't know if you can see it, but you learn how to read strips. You learn and you understand when you're reading these strips, you are getting to know how your baby's tolerating contractions, and if your baby may have a cord wrapped around his or her neck. So this book comes in handy. It's the 8th edition, and maybe you can purchase your own because you do have to give it back to your educator. That's another tool that they give you. And again, just like to remind you, once your orientation is done, that's your orientation to the unit and your preceptor, but you are still a resident. So you're still in the program for 13 months. So you will still be taking classes outside of your orientation. So that's the benefit of being in a resident program, because you're not just getting oriented for that 13, 16 weeks that they do for you. You are still getting ongoing detailed education, which I will talk about in my part 2 video. But like now I'm going on my 3rd week off of orientation. I have a class next week on Monday, and it will be my neonate resuscitation class. So they gave me this book. Sorry for the sun, but they gave me this book to read, because if I have to revive a baby that delivers and not breathing, I would need to know how to resuscitate that baby. And you would think, oh, it's the same as your CPR classes. No, these are more detailed things for neonates. This is not infant. This is a newborn baby that's just been delivered. So I love that they are giving you hands-on training. So not only do I have to read a part of that, and part of that book, I have to take the test on Relias, and we also meet up and do some hands-on training. So the residency is something that you're getting some focus on how to apply your care to every area of your specialty. So another thing that I love about the residency program is that during my orientation and during the rotation, you actually have to go behind and walk in the shoes of every person that you will be working with, except for the doctors. So like, I had to work with the tech one day. For a whole day, I was in the shoes of the tech, so I followed the tech. I set up with the tech. I prepped with the tech. I was still a nurse, but I was in the tech role. So if my tech had to do a C-section, I went with my tech and prepped for the C-section. And if my tech had to do a vaginal delivery, I followed my tech that day and prepped to do the vaginal delivery. And that is great, because who knows if you'll be able to have, because we honestly only have 2 techs on the floor. That's 2 techs on the whole L&D floor, and there's 9 rooms. So your two techs can't be in all 9 rooms. You might have to be that tech for your doctor, and it'd be just you and your doctor and your infant transit nurse that will be there. So you might have to learn how to be the tech and also deliver the baby with the doctor. So I felt that it was really good and helpful. Then the next day or the next orientation that I had to go behind is I had to follow the postpartum nurse. So people get confused with L&D and postpartum. We are not the same nurses. We are one nurse under the umbrella of labor delivery, but I take that back. We are the same when it comes to maternity, but we are not the same when it comes to application. Our focus is definitely mama and baby, but think of labor and delivery as the ER and postpartum as the recovery. Yeah, L&D is more of an emergency, and just think of us as we're the ones that's doing all the emergency stuff, like the delivering the baby and making sure you're not bleeding out and massaging your fundus and making sure your baby's okay. You staying with us and make sure your vitals are okay, making sure that you are fine, and then we transfer you over to postpartum where you'll start getting your care as far as constant fundal massages and make sure your baby's okay. So that's called the couplet care, and that's just you transitioning out of the hospital. So anyway, you get to follow the postpartum nurse and a whole day with that postpartum nurse and doing couplet care. And you kind of, before you chose your specialty, you should have known if you wanted to be a postpartum nurse or an L&D, but I already knew that. I'm just too hyper-focused, and I'm too much of that type of person that has to keep on doing something, and I just felt like it was too much downtime on postpartum for me. And so I kind of get bored quickly. So I'm really happy at being L&D. It can be fast-paced, it can be a lot, it can be overwhelming, but it's something that I am challenged up for. So yeah, you get to follow the postpartum nurse for one day. You also get to follow the infant nurse, which is basically trans and admit nurse, and those are the people who catch the baby. So you have a postpartum nurse, you have your L&D nurse, and you have a baby catcher. Postpartum nurse is on a whole nother unit. You have L&D and infant admit in the room of your delivery, and that is the woman who comes in, puts your baby on your chest. Sometimes it's us, sometimes it's them, and they do your baby checks and everything. So we follow them because we need to learn how to catch the baby just in case they're not able to help us. We give vaccines to the baby. So it's amazing. You get to follow them the whole day. And sometimes you end up doing a C-section with them, and you're getting to walk a mile in every person's shoes so you can understand not only what they do, but the stressors that they endure, so that as an L&D nurse, you won't be wondering or thinking, oh, they're not doing nothing, what's taking so long, because you understand what can be taking place on their part. And I love that because it opens your mind and gives you a better perspective of what you are dealing with as a team, not just as the L&D nurse, but as a team. You understand everybody's practice, you understand what's going on and what could be happening and why this person's not able to help you, and you are to step into that role and do that. So you wear many hats. You will have to wear many hats as an L&D nurse. So yes, yeah, that is following the infant nurse. Sometimes with the infant nurse you go to NICU, and those are the babies that end up being preterm deliveries and having to have lots of tubes and all of this other stuff. So lastly, you get to follow the lactation console, because as an L&D nurse, you will have to know how to teach the mom how to breastfeed. Your mom is with you for the first 2 hours after delivery. You stay in the room for 1 whole hour to make sure she doesn't have any bleeding, to make sure that she is stabilized, baby's okay. You don't leave that room for an hour. And within that hour of skin to skin, you're already teaching mom how to breastfeed, which is perfect because I am a breastfeeding advocate. And so you get training with your lactation nurse, and this is like a whole day. I ended up getting extensive training because not only do I love it and I am an advocate for it, but I requested it, and they were so happy to know because they say that they need more of us nurses to be advocating for breastfeeding and teaching these moms how to breastfeed and actually knowing what to do when it comes to breastfeeding. So I got more than normal training, and I'm okay with that because I do want moms to get that latch on why they can and feel comfortable in anything that they feel uncomfortable with. They can talk about it right then and there. So yes, so you get to follow the shoes of the tech, you get to follow the shoes of the infant nurse, the admit, you get to follow the shoes of the lactation, and you also get to follow the shoes of the postpartum nurse. So those are 4 different people. And I feel like it's exceptionally well, and it's a good opportunity for you to understand what everyone is going through. All of this takes place before the end of your orientation. Now, I am grateful because during my orientation, I've experienced some crazy stuff. Most of the time, people don't get lucky and experience all the difficulty situations they don't get to experience the difficult situations while on orientation. They experience it after. However, for me, all of it was on orientation. So I had my preceptors with me. I faced a uterine rupture, meaning I caught one, and that was based off of the signs and symptoms that a mom gave me. And I faced hemorrhage, a mom who basically hemorrhage. I've faced, I've had to care for gestational diabetes, preeclampsia, liminal MAC, insulin, like all of the critical cares that you probably wouldn't think you would run into while you're in orientation. I did. I know how to manage that and document that and assess that and make sure the levels are good and doing your physical assessment and all that good stuff. So what else? I have a list. Oh, shoulder dystocia. Face that too. So, you get so shaky when you're facing these things, but I am grateful. I kid you not. I am grateful because I am happy I faced these things while with my preceptor because it has made me feel more confident. I know what I've experienced already, and I know what to look out for. Let's continue. Oh, yeah. So, drug abuse. I faced that as well. Not me, but I was keen to see that happen. So, and AMA, like I faced that as well. Leaving against medical advice, like it's just so crazy that you wouldn't think that you would face these type of things, but they are happening. They are happening every day, and you're not alone. Your team, your supervisor, your manager, and God, your workers are always around and supporting you and helpful to support you if you are in need. And also you have a DON that's on the floor, and I am so grateful for my director of nursing. She's amazing as well, very supportive of the team and will step in anytime and help you. And so when I had to face that, those difficult things, they're there, and so I'm happy about that. I feel like it's a team effort and teamwork thing that I am walking through. Gosh, what is the most difficult thing that I had to face? I feel like the most difficult thing that I had to face for myself was imposter syndrome. And if you don't know what imposter syndrome is, that is basically you in a place where you feel like you don't belong. I am the only black L&D nurse. I'm the only black labor and delivery nurse on my floor. There is no other black nurse that I've run into on my unit, not even on nights. I am the only black nurse, and so not just on I'm not gonna make an excuse for it. I felt I had imposter syndrome for a while, and it was very overwhelming for me. I had moments of depression. Like, I'm in my dream career, but I felt overwhelmed and depressed because I didn't feel like I could relate to anyone. You know, we relate on the basis of our career, but as far as just like commonality, backgrounds, and things that you go through, it's kind of hard, you know. But I did open up to my coworkers. There are some very friendly ones, and then you have those that you just probably won't mesh with. But you know what? It's not part of your whole, you know, your past. You just open up with whoever you open up with. And I am learning to not just focus on that I am the only Black L&D nurse, but I am learning how to be not only different, but be a difference. And I think your perspective have to come in. You have to have an open mind, and you have to be have a perspective of change. And this is the reason why I chose this field, because there's not enough of us. And I can go into this on another level, a different time. But yeah, I think I'm gonna stop there, because I feel like that could be a whole nother video. That could be a whole nother video, yo. This is just part 1 of my L&D orientation and residency. There will be a part 2. I just wanted to make this video long, but just tell you what I've experienced, what I've been going through, and mark this as my end of my orientation. So yeah, there will be part 2. I hope you enjoyed this video. I hope it wasn't too laid back for you, because it definitely was for me. I am sitting here laid back, and just conversing, letting you know what I've been going through and what's happening. I do want to talk about my issues with COVID. That is a whole nother video as well. That'll probably be part 2 or part 3, but yeah, we can tap into that, because I feel like that is, I did not expect myself to be working and getting into my dream career in the middle of a pandemic. That is a whole nother story, guys. To the new grads, I hope you found this informative. Comment below, let me know if you're thinking about doing a residency program, and if you have, what was your experience like? I would love to know and hear your story. What specialty did you choose? And were you able to get in your specialty? What other videos do you want me to talk about when it comes to labor and delivery and my experience here? Shoot me an inbox. I love conversing with some of you guys in my IG mail. So yeah, hit me up. Until next time. I hope that you found this not just entertaining, but informative. Thank you so much for just taking time out to hear my story and my journey. Check out my blog page. I definitely blog Be Bold Liquid Gold. There I have many blogs for you moms out there that are interested in breastfeeding, and I even have some information for first-time dads. So check those out, and I hope you enjoy. See you next time.